My brother-in-law Leonard died by suicide on September 20th, 2016. And on December 17th, 2016, my husband Lindsay also died by suicide after a very lengthy battle with clinical depression and bipolar disorder. And it was a very trying, difficult time. But I felt that at this point in time, my voice needed to be heard.
As a first responder, today, this past 5-10 years, probably 30 to 40% of what we respond to is directly related to mental health. Our area has been, inundated with mental health crises, and it's not just the suicides. It's every second day it seems like we're taking somebody somewhere, picking up somebody in their home for a mental health related issue. The number of mental health calls we have certainly impacts our ambulance crew and crews, especially when we're from a small, tight-knit community, and we know a lot of the families, we know a lot of the people that we're responding to, so the connection there is emotional for us. And when you're actually dealing with your partner's family, loved one, your own family, loved one, it is taking a toll on us.
There had been a sense of urgency in our community created, and our service, our mental health and addiction service, had become very crisis-driven. We were losing people in the community at an unprecedented rate. Over a 16-month period, we had lost 14 people to suicide in several of our small, close-knit communities. The communities were trying to come to terms with these tragedies and asking why this was happening on the Burin Peninsula. And as frontline providers and clinicians, we were feeling the impact of feeling overwhelmed, stressed, feeling like we weren't doing enough for the community to help prevent these suicides from occurring. Grand Bank, who only has a population of 2,000 people, they had lost 4 individuals.
So we knew we had a problem. We knew we had a serious problem. So the Mayor Rex Matthews, called CEO Mr. Diamond of Eastern Health, and in no time, Mr. Diamond had staff, senior staff and Vice President out to meet with Mayor Matthews and discuss the concerns and the problems.
Now, at the same time, Eastern Health was entering into some community consultations around primary health care. So Eastern Health had already started thinking about working differently. So we went to 4 communities, 4 areas on the Burin Peninsula, and we asked people about health and what was important to them. And in each of those consultations, mental health and addictions came out in the top 3 priorities of health on the Burin Peninsula. And the public very loudly said, we need change, we can't access the service, something needs to happen.
We knew something had to change. There was so much pain and trauma and loss in this community. We had a lot of suicides, we had a lot of long waits for services, and we had people who had lost family members, who had lost co-workers, who had lost neighbors. And we heard that pain and that cry, and we knew that we needed to come together and start to find some solutions to improve how we support mental health and wellness from a primary health care lens and a general health wellness lens here on the Burin Peninsula. So we wanted to ensure that we had a broad representation of both health and community, and really to look at building a true partnership on how do we improve mental health and wellness on the Burin Peninsula.
I said, I want to be involved. I want to make a change. I want my husband's death not to be in vain, and I want him to have a voice that he could never have in his own lifetime.
In our old way of doing things, I think we were very system-centered and not client-centered. We were doing a lot of unnecessary paperwork that wasn't meeting the needs of the client, but was meeting the needs of the system.
I think the biggest difference in the approach to change this time was that the ideas about what the change would be, how it would happen, what the goal was, and what was needed came directly from the people involved. So people in the community, service providers such as myself, got a chance to speak out and say what we thought was needed and how that would look. Instead of the ideas coming from top down, it actually came bottom up.
We heard frustration, we heard loss, We heard a little bit of anger. But what happened was that we actually listened. And it's only in listening that the change can really start to happen.
Management staff got together with their hands-on people here on the Burin Peninsula and decided that there needs to be changes the way we deal with mental health and addictions on the Burin Peninsula. And what happened is that the staff jumped at that opportunity to make the changes. From that, it's all, for us, it's been all positive, to be honest with you, all positive.
The community can challenge some of our perceptions, some of our fears, some of our resistance, and we're able to then start co-creating something in a different way. So you work together, and the first team that solves the puzzle wins a prize. We really need to provide opportunities for people to safely consider alternate ways of thinking or viewing the world. So sometimes that happens through conversation between community or health and their different perspectives. Other times we can use different activities, different learning opportunities, different games that help people to start considering maybe there's another way that I can view the world. Maybe there's another way that I can understand my work. And then they're able to take that knowledge and attach it to their clinical or real life experiences.
We thought outside the box and we were like, maybe they got pieces over there that we need. But without thinking that, we would have just stayed here and said, well, that's it. We don't have another piece. We can't solve this puzzle.
We sometimes don't get the opportunity to do what Diane explained to us, to sit back, look out around us and say, okay, I'm having trouble here, I'm struggling. Where can I look for that solution?
We were a part of the process that got us to this point. We were very much involved in the problem solving that got us here. And we were encouraged to think outside the box. And we actually took it a step further and we got rid of that box. And we created a brand new service that I feel is the Cadillac service of mental health and addictions.
Well, the solution was we needed to deliver service when the client wanted it. When they realized themselves that they required a service, we had to be there. We had to be ready to deliver it. And so we as a group, stakeholder group, as a service, had to look at our processes and remove some of the busy things that at the end of the day wasn't helpful to the client, which is what we did when we opened our doors and said, you can walk in at any time that you need a service.
The main thing that changed was how we were delivering our service. We went from a referral and appointment and waitlist model to a walk-in model with no waitlist, no wait time, and client-centered service where we are meeting the needs of the client exactly when they need us.
Hi, nice to see you. Come on in. I'm glad you came back. I think the importance of being able to offer this service to the students here at John Burke through a walk-in clinic is important because early intervention helps those children develop positive coping skills, a positive self-esteem. It helps them learn tools and tips that they can use throughout their life. So the earlier you intervene, the more positive that outlook becomes.
Thankfully, this past year now, things have quietened down a lot, and hopefully we're over that hump. And our mental health is starting to stabilize here in this area. When I started first, most of the mental health patients we dealt with were during interfacility transfers. But now it seems like patients are more willing to call for an ambulance when they're in their crises or in their time of need, at their home or wherever they may be, right? So we're responding to those emergency calls as well as, the physical and trauma calls, right? So, it's great that the barriers are being broken, the stigma is being, reduced. It's a long ways to go yet, but we're getting there. For us as paramedics, we've certainly seen a big increase in the amount of help that we can get. I think the awareness alone has certainly helped us tremendously. The nursing staff at the Dr. Respected Health Center, they certainly recognize when we have a difficult call, and they got no problem calling us aside and say, Derek, do you need to have a little chat or whatever. We now have a full-time mental health nurse at the health center here in Grand Bank, and she's always just a phone call away or whatever, and that's certainly great.
That's the important thing, is that it doesn't always have to be the same method that we all use, but that we all got a way to decompress or de-stress or find relaxation and peace in our lives, right? Amongst the things that we do find stressful.
I like seeing that people now are more willingly open to talk about their mental health. They come to our facilities and our physicians now can ask them about their physical health as to why they came, but they'll also say, how's your mental health today? And now our patients will actually respond. They won't hide the mental health and keep that stigma there. They'll actually let it go and actually discuss openly how they're feeling mentally.
Let's just stop what we're doing for a second and repeat after me, okay? I am enough.
I am enough.
I am lovable.
I am lovable.
I am safe.
I am safe.
I am powerful.
I am powerful.
I am
I am powerful.
powerful.
I am worthy.
I am worthy.
I am healthy.
I am healthy.
I am peaceful.
I am peaceful.
I am happy.
Having mental health illness clinic here made it a lot easier to have consultations earlier, to improve the patient's outcome. The patient outcome, you cannot imagine, have improved a lot. And they do have nice programs to deal with the patients, to improve their, like they provide them a chance to speak to people from the same illnesses. They share experiences together, and you cannot imagine how much improvement have been made.
The level of change that was possible and realised here on the Burin Peninsula is possible in all of our communities in Newfoundland and Labrador. And those teams and communities deserve the same level of support and facilitation that this community had. So we need to ensure that we have people trained and ready to go out and support these communities and these individuals and healthcare providers in really making a difference in primary healthcare and mental health and addictions in our province.
Totally positive, totally positive. I mean, the difference is unbelievable, really, to be honest with you. Like, I mean, is it all over? I mean, we got to fix all? No. But where we've gone from 2016 to 2019, it's fantastic, really, and we're very, very pleased.
I mean, this was a change that was spearheaded by community. It was come up, you know, the community came up with the solution, and the community is still sustaining it in working with us in Eastern Health to keep, you know, everything going. It is absolutely exciting for sure, and something we can hang our hat on to say it started here.